From the heart of Houston, it's fun, it's engaging, it's Chattin' with Chelsea. She's daytime's new bestie. Here's your host, Chelsea Edwards. Come back to me. I've got the feeling. Come back.
Hey, besties. Welcome to another episode of Chattin' with Chelsea. I'm your daytime bestie, Chelsea Edwards. It is Alopecia Awareness Month, and today we're going to chat about how your toxic beauty could be destroying your scalp. Yes. And here's another I didn't know that moment. Ladies, menopause is not just about hot flashes. Did you know it could also snatch your edges and leave you balding? I did not. So we've got some expert advice here today to tell us what to look out for and how to get some help. Now, for those of you who don't think a hot flash is really hot, my girl Tracy has a demonstration for you.
You should wipe off your. When the flash starts flashing and the flash is flashing, the flash, 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 flashing.
Flash, 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 and the flash is flashing. I love a friend who can laugh with you, all right? Now, my girl Aislinn here, she has me laughing as well. She has a we listen and we do not judge alopecia edition.
We listen and we don't judge. Alopecia edition. When I get pulled over, I take my wig off before the cop gets to the window so I can be let off the hook. It's worked a few times. Listen and we don't judge. My showers are less than a minute because there's literally nothing for me to do. We listen and we don't judge. The local donut shop has been giving me free donuts for over a year, and I think it's because they think I have cancer and I haven't corrected them yet and told them I have alopecia. We listen and we don't judge. When I go to concerts, I don't wear a wig, so the artist will notice me. It worked last night at Zach Bryan. He gave me a shirt and held my hand, so. We listen and we don't judge. When I don't want to see a certain person when I go somewhere, I just wear a different color wig, so then they don't think I'm there, but I am. We listen and we don't judge. When somebody tells me that I'm a warrior and I'm going to win this fight in public, I just go with it because it's too awkward to tell them that I'm not actually dying.
Wow. We are not judging. It sounds like she's getting some benefits.
Right.
Yeah, you do your thing.
Yes, absolutely.
Yeah, so welcome to Chat with Chelsea. Taneka Walker, founder of Walker Wellness and Aesthetics Clinic. And welcome back, Dr. Leola Anifowoshe.
Thank you.
Okay, Texas Hair Restoration and Wellness Center.
Yes.
You give such great information. We had to have you come back for Alopecia Awareness Month.
Thank you.
All right, so let's start from the beginning. Just a rewind for those of us who aren't really aware of what alopecia is, how it starts. Let's start there. What is alopecia?
Alopecia is just a medical term that means hair loss.
It could be hair loss from different things, right?
Correct. There could be several reasons. It could be from tightening, wearing hair tightened styles. It could be from cancer. It could be from, we have what we call male pattern baldness. So there could be, it affects both men and women. And so there could be different types.
Okay, and you had your own experience with that, with the hairstyle affecting your scalp.
I did have my own experience when I was in the military. I was in the military for 25 years, and in the military we are required to wear our hair in regulations. So it was always in a ponytail with a bun, and the tension over time would pull and cause hair loss.
Okay, and alopecia can affect anyone, any age, doesn't matter?
Yes.
Any age.
In my clinic, I have 2-year-olds.
What? Mm-hmm. Wow.
2-year-olds, 13-year-olds, kids, elderly people. 70 or 80. It doesn't have an age.
Okay. And does it always start the same way? People just noticing extra hair in their brush, or?
Sometimes, someone just called me the other day and he said the scan in his church caught the back of his head and he saw a big hole in his head and realized, hey, I'm balding. So It's all types of ways people can see it. Sometimes it's the comb, sometimes it's that photo that gives us that knee-jerk reaction, but.
And so it's not even necessarily just your scalp. It also can start experiencing hair loss in your eyebrows. Or other parts of your body. So alopecia is just not the scalp, it's hair loss in any part of the body. So it can affect more than one part.
It could
as
be
well.
anywhere, yes. Okay, and so we've talked before about there are treatments for this. It doesn't necessarily mean that you just lose your hair and it's gone. Is that true?
Yeah.
Correct. There are different types of treatments. If you still have follicles, we can stimulate your follicles to get your hair to grow, and that would determine again if you have follicles. But there's different types of treatments. I always tell my patients, let's start back with the basics. Let's see, like take care of your hair, your scalp. Make sure you're using a gentle sulfate-free shampoo and get a condition, get your ends clipped. But it's also what we put in our mouths, and our diet and our exercise. Diet, exercise, hydration can play a part of hydrating those follicles and getting them stimulated. And I like to, before we talk medical terms, I like to assess a diet and to see what actual treatments, because not all treatments are the same. People may think that, I can do steroid injections and that's going to make my hair grow. Well, that's not necessarily what's going to make your hair grow. And today, what's so great about it, there's so many non-surgical platforms and treatments that we could do to treat hair loss.
Okay, and Dr. Annie, I know you have a lot of solutions. And also we're going to talk about how those things that you're putting on your hair could be leading to hair loss. But first we're going to take a quick commercial break, okay? And we got to talk about menopause causing hair loss. It's really interesting. You guys do not want to miss this. We'll be right back after this. Hair loss can be caused by hormonal changes, medical conditions, a host of other reasons. But what about what you're putting on your head? Could hair loss be caused by that? Well, Dr. Anifowoshe says yes.
Absolutely yes.
Okay, tell me a little more about that.
Especially all these beautiful wigs and weaves. I mean, they're gorgeous, but you have to check them.
Okay.
You have to check them like a relationship. They look good, but you have to check them.
Yeah, you're doing too much. Is it wearing the wigs and the weaves too much? Is that what could cause alopecia?
It could be. The frequency is one thing, but the way in which we treat them, right? Because a lot of these wigs and weaves have so many chemicals and dyes, formaldehyde, things that can seep into our skin.
Oh, wow.
So you just need to know what you're dealing with. It's not always just a beautiful packaging. Just like on products, you have to know what you're dealing with. So it's a myriad of things that could be causing the problems with the hair loss.
Okay, and that's recently been making headlines, like people finding out that the braiding hair actually has those harmful chemicals in there. So what should we be looking for? What should we be doing? You mentioned like pre-treating the hair before you use it.
Absolutely. And now we've raised a lot of sand. That's the old people used to say about it. So now I've noticed that the packaging actually has antibacterial, antifungal. So you can read the packaging and see if it's already properly treated. But if not, you can do it at home. That good old cupboard has some great things in it. White vinegar.
White vinegar.
Yes,
okay.
White vinegar is your friend when you're dealing with hair wigs, weaves, all of it. So what you do is you take 1 part white vinegar, 3 parts water, and that will kill like bacteria, fungus, and also it changes the environment, the pH of the wig, the fiber, so it won't be as harmful. So if you don't do anything else, do that.
Okay, so if that kills the bacteria and fungus, is it also neutralizing some of those harmful chemicals that are on the hair?
Absolutely, and sometimes you can actually visually see it float up. Sometimes I've seen it like little floaties, like a little cloud. You can see the bacteria float to the top.
Oh, wow.
So it really does neutralize a lot of that.
Okay, so what's the solution that we're talking about? We're talking about half water, half vinegar, how?
No, 3 parts. 3 parts
parts
water to 1 part vinegar. So if you use 1 cup of vinegar, a half a cup of vinegar, use 1.5 cups of water. So whatever you use, 1 to 3.
Okay.
That's all you need. And let it soak for a few minutes and let it come out, Or especially this hair weave, the braids. If you ever had your hair braided and all of a sudden you're doing what I call scalp slap.
Oh yeah, because you don't want to scratch.
Yeah, the scalp slap.
You're doing a pat. Okay.
Yeah, the pat. I've coined the term scalp slap. Well, if you're doing that, that's just because there's some type of bacterial infection or something antagonizing your scalp. So that's a telltale sign. So pre-treat that hair and you'll totally eliminate that.
Okay. Is there anything we should do or that you recommend after doing the vinegar? Like it's just let it soak, take it out, shake it out, and we're good to go?
Yeah, let it dry, but then they have shampoos, pH balanced shampoos, sulfate-free shampoos, because we don't want these sulfates soaking into our bodies.
Oh, okay.
So we just have to beware, right? Buyer beware, caveat emptor, buyer beware of what you're using. So there are shampoos that tell you, they have really good shampoos for wigs, but to be on the really safe side, You can get what they have is wigs that are for, more advanced wigs.
Oh, okay. All right. So maybe spend a little more coin and get an advanced wig.
Yeah, get advanced wigs, or wigs that are just not just necessarily off the shelf, so to speak. So they're custom made units. You can get those.
Okay. Where do we find these advanced wigs, and what do we look for? Are we Googling certain terms to avoid
medical grade?
chemicals?
You're looking for the word medical grade wigs.
Okay.
Those are usually custom made, and a lot of times they're actually even covered by your insurance, because insurance doesn't cover a lot of hair loss. They consider it cosmetic, but some of them are actually cover a medical grade unit. And you would just ask them, do you cover that? Go to your trichologist, get it written up by your dermatologist, and get you if you're going to wear a medical grade wig.
Okay.
Long term.
Okay, got it. All right, so you mentioned the sulfates, not wanting to have the sulfates on our scalp, but a lot of our shampoos have that. So are we...
And the parabens.
And the parabens. So are we also needing to look for products that don't have these things as well to avoid the results of those chemicals?
Especially, you need to look for sulfate and paraben free, because those affect our hormones, and there are studies that suggest it's a direct correlation how they affect the way our hormones are, your thyroid and things like that. So just be real careful, because there are shampoos, they may not lather as well, but you don't need all that leather to cleanse.
Okay, we don't need the lather to be clean.
You don't need all that lather. It's okay, but sometimes the pros outweigh the cons outweigh the pros.
Okay, all right. So looking for those products without it. Now, I know you have lots of products.
I do,
and they all do not have those things.
No sulfates, no parabens, not animal tested, any of that. They're very safe.
Okay, and at your center, have you seen patients who have the hair loss as a result of the products that they're using?
Oh, absolutely, by far. It could be products. A lot of times it's mishandling of tools, though. Using the hot comb, overusing the straightening comb, overusing curlers. A lot of times is that. So if you're going to curl your hair often, then use a heat protectant, something like that. Everything can be done. It's just how you do it. Okay. If you're going to wear wigs a lot, then clean those wigs every 7 to 10 uses. Because if you do not, the amount of sweat and bacteria will trap into your scalp and cause your follicles to build up bacteria. And then now you're starting to have hair loss. So it's not what you do, it's how you do it. I mean, let's face it. We've been wearing wigs from Africa, from Europe. It's just a thing women do. You're going to always do it. You don't have to hate doing it. You just have to know how and what you're doing. Be mindful of it.
Yes, and then select some better products that might be better for you.
Oh, by far. They're not all created the same. And it's some real strange stuff going on in this hair, where they got these real fancy advertisements, but the results aren't matching the noise. So your hair is always talking to you.
Okay. Hey, girl.
Yeah, you know what I'm saying? Girl, calm down. I'm thirsty. And if your hair is dry, don't be angry at your hair. You wouldn't be angry at your body. If you were thirsty, you would simply hydrate.
Okay.
So if you have that type of hair that's often dry, then perhaps it's a sulfate shampoo or something doing that to it. But if it's not, and you have a shampoo you like, just hydrate more often.
Oh, okay. All right. I would just say, before you even buy it, though, at this point, now that we know, you can turn it around, check those ingredients.
Yes.
Okay, because that's having an effect on your hormones.
Yes, your hormones, your mood, and all types of, just the texture of your hair. And over a period of time, it can actually alter the texture, and your hair will just start breaking. And women should also change their shampoos. So here's a rule that I hope all of them will take away from this. Change your shampoos once a month. Alternate. So the shampoo from microcirculation point of view, it'll be like, oh, something new. And your follicles will respond accordingly. So change your shampoos up. But if you're dealing with hair loss, you need to use shampoos and conditioners strictly for hair loss, because now we're dealing with a microcirculation problem.
Okay, all right. Oh, that's a great place to go ahead and switch it up, because you mentioned the hormones. We got to get into menopause causing the hair loss. So we'll be right back with that after this. If menopause weren't already enough of a trip, you might have to deal with some hair loss as well. So Taneka Walker,
Yes.
you've helped women dealing with this as well. Like menopause comes on, they've got all these things to deal with, hot flashes and all, and then they might notice some hair missing. Is it
Right.
particularly around the edges?
Yes, it is particularly around the edges and the frontal lobe of the hair.
Huh. Okay, so this is something that's been going on. Like, I feel like we're hearing about this more now.
So we are hearing about it more, but it's nothing new. Menopause has the same symptoms that it's always had. Hot flashes, mood swings, and thinning hair, hair loss, and dry skin. So when Jada Pinkett came out with alopecia, that was like the grace for women to be like, oh, there's something. So I think now more women are just going to the doctor, they're saying, hey, and they're not afraid. At first, sometimes we live in our own fears and we don't know, like, hey, what's the problem? We're just like, and we suffer in silence. I think when Jada came out, it made all of us know, like, hey, wait a minute, this is a medical condition, and I don't have to be self-conscious. I don't have to be embarrassed about it. So more women are going to the doctor, and then they're experiencing the same thing. So this brought more awareness of how menopause affects alopecia.
Okay, so with that awareness, do we have more options or more treatments or ways to stop it or keep our hair?
So there's no ways. So once you suffer with menopause, what it does is it shrinks the follicles and it damages them. And that type, when we're talking about hair loss with menopause, those are, because the follicles are shrinked and damaged, those are irreversible. So what we do, we have ways to minimize and decrease for more hair loss, you'll say.
Okay,
So
all
we
right.
can treat those.
Okay, so what do those treatments look like?
So those treatments look like, first we're going to treat the symptoms of menopause. Well, that would be a hormone therapy. We can do for the symptoms of hot flashes, things like that. We'll do like an antidepressant, a Prozac, something like that. And then when it comes to the hair loss portion of it, there's things that there's topical, and then there's incisional corticosteroids. We can do injectable corticosteroids. And then we can do some finasteride, we can do some minoxidil, we can do, there's topicals, there's also shampoos that we could do to slow down and minimize the hair loss.
Okay, all right. I heard some big words in there. So we just need to come to the clinic to find out how these things work. When it comes to catching it early on, what are we looking for? I mean, because I don't want people to panic after they see just a few more follicles falling into the brush, but how do they know? They need to go see someone, and this could be alopecia.
So what we want to let women know, and everyone, hair shedding is normal. We can lose about 100 strands a day. That's typical for me, you, everyone. That's typical. So we're going to have some shedding. But when you can notice that brush is like maybe filling up more, and it is consistent, or you notice the thinning around the frontal lobes of it, those are the things that you want to seek medical attention for.
Okay, does it make a difference if we come early, like as soon as we see something?
It does make a difference soon. Early detection reduces and prevents, we can slow the progression.
Okay.
So getting treated, when you first notice it, come and get treated or get seen about it, we can start those medications that I mentioned.
How long until we start seeing some results? Is there a way to gauge if what we're trying is working?
Well, consistency is key. So I always tell my patients that we're partners.
Okay.
I need you to do your part, and I'm going to do mine. And that means, like, we talk diet. You know, I always go back to the basics. Let's talk, how's your protein? What is your omega-3? Are you taking enough iron, zinc? Like, are we getting that vitamin D and that vitamin B12? And it's so funny because most people are like, well, what is vitamin D and vitamin B12?
No.
Like, it's all connected. Are you staying hydrated?
Well, if they're asking those questions, they haven't been watching Chattin with Chelsea.
Right.
'Cause we have talked about taking your vitamins before.
Right,
Okay.
right. And the importance of them. So we start back with the basics. So definitely, if you're starting early, we catch those things. We correct your diet. We talk about ways to reduce stress. It's like all of those things play a part of it. And then with early detection with those, it can definitely slow the progression.
Okay, are we coming in and attacking all of these things at once, or are we trying different things to see what'll work for the hair loss, especially when it comes to these menopausal women?
Diet, exercise, reducing stress, that's something we should be doing every day.
Okay, you're like, you should already.
I mean, it's like, are we attacking? We're really not attacking all of them, because those are things that we should be incorporating in our daily, just as our whole person.
Got it.
So I'm one of those. I believe in a combination approach. The hair has a cycle, and there's different cycles. So I'll throw a laser cap at you. We'll do a PRP. Like, we'll do several things at one time. But I'm also talking to you about your diet and your exercise, making sure you get your vitamins in. So it's a combination therapy approach that I believe in at our clinic. And then if you follow that combination approach, you should start seeing some results in about 3 to 6 months.
Okay, all right. Is this something that women see in perimenopause as well? Like before they're fully menopausal, can we also see this hair loss at that time?
Perimenopausal starts between the ages of 40, and you definitely could start seeing hair thinning and hair loss, and that draws back to the early detection. So when you're in perimenopausal phase, let's go ahead and get seen and get treated.
Oh, all right. Well, since I've had my eyes opened talking with you, is there anything else that you want women who are dealing with menopause and hair loss, anything else you feel like they should know?
Like we talked about, early detection. And I feel like back to the basics. When was the last time, doctor did a great talk about paraffin and gentle paraffin-free shampoos and sulfate-free shampoos. Let's get back to the basics. When have you clipped your ends? When have you done a deep condition, a shampoo? Like, we have to start back with the basic foundation. How much water are you getting? It's like those things that can be done at home before you go consult a healthcare professional. And then also now, the self-confidence that hair loss, like, I want to let women know, like, you can embrace it. Like, you do not have to, there's no more hiding in fear. There's no more being embarrassed. Like, embrace the stage that you're in. And I think that was one of the good things that came out of Jada Pinkett. Like, people can rock their bald head and look cute doing it.
Yes.
And so that's what I want to empower women, and that's what I would leave women with.
I love it. Absolutely. Because you all are still beautiful.
Yes.
Okay.
Yes.
All right. Now keep your beautiful behinds right there, because we're going to take a quick break and we'll be right back after this. I want to thank you for watching this episode of Chattin' with Chelsea. Dr. Annie, final tip before we go.
Come in and get tested. We don't guess, we test. Find out what's going on. There's no time for guesswork.
That's right. All right.
Final tip is stay hydrated, nutrition, and exfoliate your scalp.
Exfoliate the scalp.
Exfoliate
Good,
your
great
scalp.
tip. Okay, guys, you can keep up with us on social at Chelsea Show Fox. Thank you, ladies, for coming on Chattin' with Chelsea.
Thank you for having us.
Yes, and we'll see you on the next episode.
Got the